Well, mental health for women is very important because if a woman is struggling with a mental health issue, it can totally affect her quality of life. It can affect her relationships. It can affect her productivity in her career or in other aspects of her life. And most women are working on their careers, they're taking care of families, they're doing other various things in their life with the economy and things the way they are. There's lots of struggles. Women tend to just keep putting one foot in front of the other and keep going, and they really ignore themselves and taking care of themselves. And we can get really far down the road with a mental health issue before we seek treatment. So it's important to pay attention early. So if you're starting to struggle, you can get help early to avoid some of the major pitfalls. It's really important to know the signs of depression. If you're having interrupted sleep, meaning oversleeping, undersleeping, if you're experiencing interruption in your appetite, either overeating or undereating, gaining weight, losing weight without really trying, if you're finding that you're sad most days, every day, all day, if your energy level is extremely low, those are all red flags that there might be some depression setting in. It's difficult sometimes to think that that's the path you might be on, but if you can catch it early, like I said before, and get treatment, then it's very manageable. With stress, stress is a huge deal in our society, and if you're finding yourself experiencing signs of depression, but also anxiety, having gastric disruptions, in other words, upset stomach, joint pain, achiness, headaches, those are other signs of stress that is getting out of control and unmanageable. Well, the first step is to recognize it, be aware of it, see what's going on. Then take an inventory. Am I eating consistently? Am I eating nutritious food, or am I always grabbing the coffee, the Coke, the sugar, that kind of stuff to get through the day? Am I exercising? Am I getting consistent sleep? Those are kind of the first baby steps in addressing the issue. If you feel like you're starting to get into more trouble, then yes, go to your family doctor, talk to them about what's going on. They can prescribe a medication to help if it's needed, and then of course, if needed, see a therapist to just gain some new coping skills, some insight. Just a third objective party to kind of help rein things back in and create some balance.